I feel like the most common reaction I get when people hear that I'm a sex therapist is first this initial look of shock, followed by the question of, okay, so what exactly do you do? What's up, folks? I'm Dr. Holly, a certified sex therapist and clinical sexologist, and today I want to talk to you a bit about what exactly is sex therapy. So what is sex therapy? Well, sex therapy is first and foremost a form of psychotherapy that is specially designed to help individuals, couples, and other relationship configurations overcome challenges that they're experiencing that are affecting their sexual satisfaction. The goal of sex therapy is to help folks address any physical, mental, emotional, or relational challenges to improve relationships and overall sexual well-being. So what exactly does a sex therapist do? Well, every clinician is different, but generally, sex therapists use a combination of psychoeducation, talk therapy, perhaps some somatic methods, and specialized sex therapy interventions to address sexual concerns such as sexual trauma recovery, mixed match libido in relationships, orgasm difficulties, erection or ejaculatory difficulties, pain during intercourse, among other sexual health concerns. Sex therapy is rooted in general therapy principles, which means that one must be a regular therapist before they can be a sex therapist. And I always emphasize this because it's important for sex therapists to be regular therapists first, so that way they are well equipped to deal with mental health, psychological, relational concerns that impact what happens in our sex lives. I always say that sex starts way before we get into the bedroom, so it's important that sex therapists are able to support the other things in our lives that happen outside of the bedroom that are impacting what's happening in the bedroom. Another thing about sex therapy that I think is important to clarify is that there is no physical contact. Sometimes people might ask, well, do sex therapists have sex with their clients? Or do they watch their clients having sex? And the answer is a resounding no. There are physical exercises within the realm of sex therapy, but those generally happen outside of the therapy room. For example, I might provide a homework assignment for a client to do at home individually or with their partner, so that way they can address some of the physical aspects of sex therapy. But there is no physical contact generally within the therapy room. So what does the sex therapy process look like? Well, in the beginning, there's generally an intake and assessment in those first sessions. And during the assessment phase, the therapist will take what's called a biopsychosocial assessment in order to gather information about the client's biological history, like any physical or medical health concerns, followed by the psychiatric or psychological history to find out if there's any mental health concerns that the client has that are impacting what's coming up sexually, as well as the social or relational history that could be playing into what their concern is. Once we complete that full assessment, that helps us get a full picture of the client. So I like to think of concerns in sex therapy kind of like a tangled up knot. And when you have a tangled up knot, there might be a string here, a string here, a string here. And what you notice with that knot is you can't just tug on one end. You kind of have to tug a little here, until eventually the whole thing unravels. So I think of each of those aspects, the physical, the mental, the relational, as different parts of that knot. And so what I like to do as a sex therapist is get an idea of everything that's impacting that knot here, so that way we can address the problem at all angles to help that knot unravel as deeply but also as efficiently as possible, so that eventually you don't need us anymore, right? That's always the goal, is that you don't need the sex therapist anymore at some point. So once we do that good, thorough assessment, then the therapist will usually create some sort of treatment plan or plan for the duration of your treatment based on whatever the client's goal is. Then the real work starts, and the real work is based on that treatment plan or helping the client accomplish those goals. And the work differs depending on what the concern is and the therapist style and what types of therapeutic modalities the therapist might use. So for example, it might include some CBT or cognitive behavioral therapy to challenge maladaptive beliefs that are contributing to sexual problems. Or it might include some EMDR or IFS if the client has a history of trauma. It might include some sort of couples therapy if there are couples involved, couples seeking treatment for sex therapy. It might include some traditional couples therapeutic modalities like EFT or emotionally focused therapy or the Gottman method of therapy in order to help the couple really develop their relational and communication skills so that they can better relate sexually. But really, it is just general psychotherapy with the additional layer of specific sex therapy interventions. And those could be something like maybe sensate focus, which is a way to help couples relate to each other physically, as well as other types of sex therapy interventions. Again, really dependent on what the client is hoping to accomplish in the therapeutic process. Additionally, throughout treatment, there might be times in which the sex therapist wants to refer to other helping professionals to better address the whole person. So, for example, if I see that a client is struggling with low desire, I want to rule out physical health concerns, and so perhaps there might be a hormonal concern. So I might refer to an endocrinologist just to check hormone levels, just so we can be clear if that's something that we need to address and perhaps there's a hormonal intervention that we want to take. Or if I have a client who's experiencing pelvic pain, I might refer to a pelvic floor PT or a pelvic floor physical therapist to help address the physical aspects of their experience of pain while I continue to address the mental or the psychosomatic experiences of the client's pain. But really, the whole therapeutic process depends on what the client is wanting to accomplish, and it's really just general therapy with the additional sex therapy training. So how can you tell if sex therapy is right for you? Well, for one, I think it's important to identify what concerns you're facing. Are you experiencing sexual pain? Or are you feeling ashamed about your experience of sexuality or your gender? Or perhaps you're having relationship issues as a result of disagreements about sex. If either of those are happening, then it might be a good idea to hire a sex therapist. Also, I think it's important to examine how those issues related to sex and sexuality are impacting your life. If sexual health concerns are impacting your daily life, self-esteem, or relationships, then I think it's a good idea to talk to someone. Also, what previous attempts have you made? Maybe you did some self-help, you read some books, and you're noticing yourself getting a little bit stuck and maybe needing extra support beyond the self-help work that you're doing. Or maybe you're in general therapy and your therapist has been really helpful in helping you accomplish some of your other mental health goals. However, you notice when you bring up the concerns that you have around sex and sexuality that your general therapist maybe isn't knowledgeable or isn't well equipped to help you with those specific concerns. If that's the case, then it might be a good idea to consult a sex therapist, perhaps as adjunct to or in addition to the therapist that you already have. Lastly, I think it's important to think about, could I use some professional guidance here? There tends to be a stigma around hiring a sex therapist because there's this idea about sex that it should be natural and everyone should know how to do it. But that couldn't be further from the truth. Sex is very much a learned behavior, and just like anything else that we might be struggling in life, it's always a good idea to see if maybe you could hire a professional. For example, if we're looking to get in better shape, we might consider hiring a personal trainer. or if we need help filing our taxes, then we might hire someone to help us do that. Sex therapy is no different. If you need additional support in this particular area of your life, there are folks out there who are trained, experienced, and well-equipped to help support you on that journey. So if you've gotten to this point and you're thinking to yourself, maybe I could use a sex therapist, but where do I find one? Well, there are ways to find a qualified sex therapist near you. For one, I recommend checking the ASECT online directory or another local online platform to find a certified sex therapist. ASECT stands for the American Association of Sexuality Educators, Counselors, and Therapists. Yes, it's a mouthful, but it is the main governing board for sex therapists in the US, and through their website you can access their online directory of certified sex therapists and search for someone specifically in your area. And I'll go ahead and link them down below. Once you find a sex therapist, I encourage you to reach out to them and schedule a consultation to see if they're a good fit for you and what you're bringing to the therapy room. I always recommend asking about their credentials and their experience, and more specifically, what is their experience in treating your specific concern? For example, are they experienced in treating ejaculatory difficulties? Are they experienced in treating pelvic pain? Have they worked with trauma survivors before? It's important to get a good idea of whether or not they are experienced with your specific concern that you have so they can tailor treatment to helping you with your concern. Also, I recommend asking about any particular identities that are important to you. For example, do you want a therapist who is understanding of non-monogamy? Do you want a therapist who has experience working with folks in the kink community? Those are other important questions to consider when looking for a sex therapist. And above all else, beyond the credentials, do you feel comfortable with this person? In order for sex therapy to be most effective, you have to be able to be open and vulnerable with your therapist. The more that they know, the more they can support you. And though I'm a firm believer that there is no such thing as TMI in sex therapy, it's important that you feel like you can be comfortable to get the most out of this experience. That's it for today. Thank you so much for watching. And if you found this video helpful and want to learn more, don't forget to hit that like button and subscribe to the channel. Your support helps me to bring more insights and tips straight to you. Have any questions or topics you'd like me to cover in future videos? Drop a comment below. I'd love to hear from you. Remember, understanding your sexual and relational health is a vital part of your overall well-being. Don't hesitate to reach out to a professional if you think you could benefit from some guidance. Until next time, stay curious, stay connected, and remember, you deserve to have a healthy, happy, and pleasurable life.